Good morning, Mr. Ryan. How are you?
Good about yourself?
Good. My name is Wendy. I'm a nurse practitioner, and I will be doing your head to toe assessment today, okay? Is that okay?
Yep.
All right. Thank you for letting me be part of your care, all right?
No problem.
Okay, before you sit down, I'm going to test your distant vision, okay? Can you hold this? And I would like you to read the smallest line you can read here, up here. The smallest, cover one eye. All right. So with your right eye, can you read the smallest line?
Line 10.
Line 10. Okay, go ahead and read it.
F D P L T C E O.
Very good. Cover the opposite eye and then read the smallest line.
Line 10.
Okay, go ahead.
F D P L T C E O.
Okay, and without covering your eyes, can you read the smallest line?
Line 11.
Okay.
P E Z O L C P T D.
Okay, very good. So number 11, his vision, without covering his eyes, his vision is 20/10, which means that he can read at 20 feet what a person with a normal vision can read at 10 feet, okay? So your vision is perfect. All right, you can have a seat. Your assessment, and your head is upright, it's midline, and it's symmetrical, okay? And your skull, there is no lumps, no bumps, okay? And I'm going to palpate your scalp, okay, if you don't mind. And his hair is full, it's curly, okay, with a normal male hair distribution. And his scalp, there's no bumps, there's no lumps. Any pain?
No.
Okay, very good. And I'm going to palpate his facial bone, okay? The facial bones. Let me know if any pain. All right, I'm sorry. I'm palpating his facial bone and the frontal sinuses, the maxillary sinuses. Any pain?
No.
Okay. And I'm going to palpate his temporomandibular joints, okay? Can you open your mouth? Close your mouth. Okay. Very good. Okay. All right. And I'm going to close your eyes. Open your eyes. Wrinkle your front head. Okay. Puff off your cheeks. Stick out your tongue. Go this way. Can you smile for me? Okay, very good. And I was testing your cranial nerve number 7, which is your facial cranial nerve. And while I'm here, I'm gonna just test for your cranial nerve number 5. All right. And I'm gonna ask you to close your eyes and say now when you feel like I'm touching you, okay? So I'm testing your light sensation, all right?
Now. Now. Now.
All right, and that was your cranial nerve number 5, okay? Now moving down, I'm going to eyelids. I'm going to inspect your eyelids, and your eyelids are covering your your iris, and your eyelashes are symmetrical and well distributed, okay? And your eyelashes are thin, okay? And I'm going to palpate your lacrimal gland, okay? Let me know if any pain. Any pain?
No.
Okay. And can you open your eyes? Okay. Your sclera, the sclera is white, the conjunctivate is visible, okay? And while I'm here, I'm going to test for your eye function, all right? And to test for your eye function, I'm gonna start with your pupillary response to light. Okay? And when I shine the light to your left pupillary, it constricts. That's a direct. And also I can see the right one also constrict. That's consensual. And doing the same thing also on your right pupillary, it constricts. And also the left one constricts. So it's direct and consensual. Now I'm going to test your pupillary accommodation. Now I'm going to, all right? So I'm gonna ask the patient to look at something very far away, and your pupil will dilate when you're looking at far away. And then I'm gonna ask you to just stare at my pen light now. As I come closer, you can see that his pupillary constrict and converge, and that's called accommodation. All right. And while I'm here, I'm going to test for your visual field. Okay. So I'm gonna ask you to cover one eye, and then tell me when you see me coming. Say now when you see me coming. Okay. All right.
Now. Now.
Tell me how many fingers do you see?
3.
Okay.
3.
Very good. The opposite eye, cover the opposite. Say now when you see my fingers coming. Look at me, look at my nose.
Now.
Okay?
Now.
Okay, very good. And that was your visual field test, which is the cranial nerve number 2, which is testing the cranial nerve number 2. Okay? So now I'm going to test the extraocular motors, which is testing the cranial nerve number 3, the cranial nerve number 4, the trochlear, and the abducens, cranial nerve number 6. Okay? So I just want you to look at me, okay, and follow my finger. Don't look at with your, don't turn your head. Just look at me and follow my finger with your eyes. Okay? Ready? Very good. And that was your extraocular movement that I was testing. All right. And now I'm going to test with the ophthalmoscope. I'm going to try to test your red reflex. Okay, my dear. All right. Okay, so I'm going to try to test your red reflex. And for that, where's the light? Okay. So I'm gonna ask the patient to, I'm gonna try to find the light reflex. Okay, the red reflex. I'm sorry, I said the light reflex. Look at straight up here. Okay, so I can see the blood vessel, the optic nerve, the macula. Look at straight here to the light. Okay. All right. And I'm gonna do the same thing with the other. Okay. I can see the disc, the blood vessel, Okay. Retinal. Okay. All right. Very good. The optic disc, the retinal vessel, okay, and the retinal surfaces. So moving along, I'm going to inspect his ears now. I can see his ears are symmetrical and well aligned, okay, and I'm going to palpate his auricle. Any pain?
No.
No numbness?
No.
And no nodules?
No.
All right. So, and I'm going to assess your hearing, which is testing also your cranial nerve number 8, the vestibular trochlear nerve, okay? So I'm going to say 2 words. You tell me what I said.
99. 99.
Okay. So that was the cranial nerve number 8, your hearing test. And I'm going to perform the otoscope inspection. All right? And for that reason, I have to grab my otoscope. And so what I'm gonna do, I'm gonna try to look at your external ear canal for a better visual. Okay, let's see. Okay, that's better. The external ear canal. There is no discharges. There's no foreign body. Okay. There is no foreign body. Okay, no discharge, no foreign body. And I'm trying to see the temporal membrane. And there's no perforation for the temporal membrane. And I'm also trying to see important landmark like the umbo and the light reflex. Okay, all right. With the opposite ear, trying to see the ear canal. Oh, the temporal membrane is gray shiny, and then important landmarks like the umbo and light reflex, and there's no perforation for the temporal membrane. Brian, you need to clean your ears a little bit. I said the temporal membrane. The tympanic membrane was a grayish, okay, pearly gray, and there was no perforation. And I also checked important landmarks like the umbo and the light reflexes, okay? And moving down to his nose, I can see his nose is symmetrical and the septum is midline. I'm going to check the patency of each nostril. Can you take a deep breath? Okay, take a deep breath also. Okay, and his nose is patent. Okay, and I'm going to inspect the mucosa, the septum of his nose. Okay, and for that, I'm going to ask my speculum. All right. I want to be careful. I don't want to go deep because the nose is very vascular. So I can see the nasal mucosa is pink, okay, and the septum, it's very pink here, and the septum is midline, straight, no deviation, no perforation. Very good. All right, so that was the septum, okay, no deviation, okay, and I'm going to assess your olfactory function. Okay.